episodes, we've discussed what is mental health as well as what is the stigma surrounding it. The purpose of this PACE program is to reduce the stigma and essentially encourage everybody to better take care of their mental health. According to the Mental Health Association of Canada, 1 in 5 people in Canada will encounter a mental health struggle. Moreover, 3.2 million children between the age of 12 and 19 are at risk for depression. These alarming statistics demonstrate the importance of taking care of our mental health. Moreover, the importance of seeking help. In this episode, we will discuss seeking help for mental health.
So when should we seek out for help? Remember the signs of struggle that we discussed in our first episode, where we just don't feel the same and we don't feel like ourselves for a long period of time? So these are the signs that we need to look out for, and that will encourage us to actually go and seek out for help. So roughly we say about 2 weeks, if we're having those signs, it's a good idea to go and seek out for help. Now, this is different than being in a crisis where you're at risk of harming yourself or others. In that case, we absolutely encourage you to go and seek out emergency services or call 911.
If you're at risk for harming yourself or harming another individual, it is very important that you reach out to some sort of emergency support system, such as 911. Take Judas Iscariot, for example. He was likely in a crisis before dying by suicide. Had he reached out to one of his disciples or sought help in other ways possible at his time, maybe he wouldn't have committed such a thing.
So why should we seek out for professional help? Well, because neither we nor the people around us are mental health professionals. Mental health professionals undergo years and years of schooling and training, so they have knowledge and skills that we simply do not have. So just like we wouldn't go to a friend to cure our broken foot, we shouldn't go to a friend to help us recover from a mental illness. Yes, friends and family are going to be a great support during that period, but they're not going to be enough.
In the book of Colossians, St. Paul mentions St. Luke the physician. It was clear at this time that physicians were needed, and it was even encouraged by the church and by Christ. Perhaps it's the will of God that someone should have a physical illness, but Christ still encourages us to go and seek some sort of treatment. In the same way, let us not ignore seeking help for our mental health, for the wounds that cannot be seen.
So who can we actually see when we need professional help with our mental health? So it actually depends on the approach that we want. If we want a medication-based approach, then it's a good idea to go and see our family doctor, who's going to be able to diagnose some mental illnesses and prescribe medication. But in some cases, he will have to actually refer us to a psychiatrist, and the psychiatrist will be able to monitor us more closely with our medication and mental illness. And if we're looking for a more therapy-based approach, we have different professionals that we can seek out to. We can go to a psychologist, a social worker, a counselor. It really depends on what we need. But even within a specific profession, they have different approaches. So for example, some psychologists like to focus more on the root of the problem and how it manifests in our everyday life. And other ones just want to focus on building skills to cope with the difficulties that we have. And so don't be shy to ask the questions that you need and to make sure that this is going to be the right fit for you. Other resources could be actually community services, where you could get peer-to-peer support, group support, or even attend workshops to better your well-being. It's important to remember that recovery is not linear. You might start off with medication and just realize along the road that you need to change it up or even seek therapy at the same time. And even if you started off with a psychologist and just realized that it didn't click with them, it's okay to change them up. Also keep in mind that if you have any questions, it's okay to ask them, and just make sure that the approach that the professional is using is the right fit for you. It might not be easy, but it's important to not give up.
It's not a bad idea to talk to your priest or talk to a friend if you think you're struggling mentally. But sometimes we need to seek professional help from someone who specializes in mental health. As members of the one body in Christ, we are to encourage each other to be mentally healthy. No one is immune to mental health struggles. And having a mental health struggle does not make you a bad Christian. Do your part. Seek help.